I'm Richard Lachiver. I'm the Corporate Medical Director for Healthways out of Franklin, Tennessee.
Tell me about your company, and I understand you're working with Hawaii physicians.
We're working with, first of all, our customer is Hawaii Medical Services Association, or HMSA, which is the Blues plan out there in Hawaii. And we've been working with them for a very long time, at least 10 years. And we've got a very good relationship with them. They're a wonderful customer for us. We find them to be very collaborative and just giving us so much opportunity to really work with them in a very positive way. But we're there to help them really support their drive to engage all of their membership in medical homes, because they're a very strong proponent of medical homes, the primary care model, and so forth. And they see our role as being very supportive of that. They see what we do, or we need to be doing, is working very directly to support that patient-physician relationship, surrounding it with layers of support, whether or not it's care coordination or data analytics or behavioral change programs, which is kind of our core set of business activities.
And it sounded like Hawaii might be a little bit behind with electronic health records.
Yeah, I think it's, again, if you go to some of the pockets of healthcare innovation, you see a lot more EMRs out there. Obviously the coasts are very forward in this evolution. You go to a lot of other places in the country, and I don't think Hawaii is necessarily that far beyond or behind a lot of those other organizations and other geographies. But I do think that there's an awful lot of providers out there that are not technologically savvy or technologically connected, and I think there's a huge opportunity there.
Okay, what are the more cost-efficient measures that you help implement?
Well, really, again, what we've tried to do is really try to focus on a number of things. One is we recognize that there's some major drivers to healthcare costs. And if you look at things like readmissions, hospital readmissions, and so forth, many of those are because of poor coordination of care or a lack of exchange of information, those sort of things. And what we really try to do is we try to connect the dots so that when somebody is in the hospital and they're about to be discharged, we take those patients and take that case or that situation. We try to make sure that there's a good understanding of what the condition is, make sure that the patient understands warning signs, symptoms, and so forth, has a good connection point to help when they get discharged, and then connecting them with their primary care physician. Part of it is also things like medicine reconciliation. So that would be on our, let's say, hospital discharge program. But it doesn't exist in isolation of just being a hospital discharge program. It really needs to exist in the context of PCMH and connecting back to the primary care doc. So we do that. We provide a lot of analytics and support like that. Our core business is really trying to change behaviors in patients. So, if you have cardiac disease or you have other types of diabetes or whatever, a lot of the factors that are going to, define what long-term success and economic efficiency in caring for those people are looking at the behavioral factors that surround that patient. Do they have adequate financial resources? Do they understand their condition appropriately? Do they have the right coaching and motivation to really stay on task in terms of compliance and so forth? And again, that's another part of what we try to bring to this, the whole equation.